Hi everyone. Thank you once again for a great response to my previous story. The sole intention behind putting up that story is the common answers which we got from so many mothers. That's just to boost your confidence that all mothers are going through it. Everyone has faced it. And if someone tells you and if someone tries to label your child as a fussy child, as a jiddi child, you don't need to listen to them, because believe me, 8 out of 10 moms are worried for their babies between the ages of 0 to 3 months that they are crying a lot. So you're not alone. Don't lose your confidence. Perform a checklist whenever the crying goes beyond a certain time, and if you feel that the baby is still crying, then there is a definite medical explanation for it. So don't lose hope, be confident. See, I always tell my parents, the mother and the father, because at times even the father is so distressed about the baby continuously crying that he passes on his tension to the mother, and the mother, even though she would be at ease initially, is really bothered when people tell her that no, your baby is crying a lot. So this video is especially for all the fathers, the mothers, the grandmoms, the granddads. You have to make life easier for the new mother. Also that as a new mother, if someone tells you that my baby never cried, I don't remember this, I don't remember him or her crying for longer than 10 minutes, 15 minutes, don't believe them. It's either they are lying or they have actually forgotten it. So because it's been so many years. So don't let anyone label your child. That's the first point which I would like to tell you guys in this video. Secondly, the checklist which I would like to give you for if your baby is crying. So firstly, hunger. Okay, it's very easy. If the child is crying, if it's been for more than like 2.5 hours and the baby is still crying, you can take him or her up, latch onto your breast or offer a bottle, whatever means of feeding you're following. And if he or she is calm down, means it was a hunger cry. Second, is the baby overtired? Is the baby sleepy? Is he or she past the bedtime? If that's the reason, try making them sleep. Also, many kids are very sensitive to noise, light, everything, change in the temperature of the room. So if you feel that your child is overlayered, take off 1 or 2 layers and see. If you feel your child is feeling hot, put on the AC, 28, 29, no direct draft. Put on the fan if you don't have an AC. And if the child is comfortable, it's all trial and error. Let me be very clear at this point. If you feel that it's been very noisy, people are watching TV, the radio is on at very loud volume, go into a dark room, try to soothe the baby. Avoid overstimulation. You can put a favorite song, a bhajan, a rhyme, whatever you're comfortable with. Try and do that. Also, many kids are extremely jittery when the diaper is soiled, the diaper is leaked, or if they have pooped. So if that's the case, you need to first check on the diaper immediately, or check on the langot, whatever you're using. Also, I get this question so often that my baby cries a lot before passing poop or passing urine, and the only answer which I try and explain it to them, that they are not aware what is happening to me. They don't know where to relieve the pressure. They don't understand, okay, this is the urine building up, this is the bladder pressure, this is what I would feel when I want to poop. So, for us, it's been very long, but for them, every experience is new. So, if that's happening, your child will get settled by 2.5 months. In many cases, even way sooner. So he or she will figure it out that where he or she needs to pass on the pressure to relieve himself or herself. So don't worry, that's also absolutely normal. So apart from all this, one of the 2-3 things which parents generally forget. One is, if your child is crying inconsolably for like half an hour, 40 minutes, you've tried everything, you make the baby nude. You take off all the clothes, turn the back, see if he or she has been, bitten by an ant. You won't believe, but even good families, very good families, which take really good care. But ants, mosquito, everything, you never know. You always examine them in the nude, check for any bites, check for any scratches. Many a times it's the tag of the blanket or the tag of the t-shirt or the loose button which might be irritating the child's skin, which might be, painful. So just check on to that. Secondly, if the child has been, has slept while feeding, and he or she has not had a burp, but is feeling really uncomfortable, is drowsy but uncomfortable, crying, that means that the child requires a burp. So I feel burping is the most underrated thing. Doctors do tell it often, but probably we don't lay enough stress that you really need to burp the baby. So if you feel that, because while sucking on the breast or sucking on the bottle, they take in a lot of air, which causes aerophagy and which causes, kind of gassy feeling, and they're not relieved until they get a burp. So if that's the case, you can try for the burp. That might be there. Also, coming last to a medical diagnosis. It's not really a medical diagnosis. It's like more of a clinical diagnosis with elimination of everything. It's called colic. So I'm going to make another video on it, but I'll just tell you the points which indicate that your child is colic. It means that, the traditional definition is around 3 weeks of age, crying for more than 3 hours, at least 3 times a week, is labeling a child colic. But in practice, I've seen that no patient or no bachu exactly, encapsulates the entire thing. So if you feel, this is my way of telling the parents that if you feel that the child is crying at a given time every day, is, kind of taking what you say, alas, very often, stretching his body very often, arching the back, all these are indirect signs of a colic baby. So let's not call the baby colic because it's purely a clinical diagnosis. Let's just call having some gastric trouble. Okay, so this is my talk for today. I'm going to try and make a video right after this on colic. See you all very soon.